Welcome back to Everyday Health Hacker, Dr. Lisa Leal and Mike Hertzing. And in today's podcast, we're going to talk about heart attacks and panic attacks. Because, a lot of people will call and they're like, oh, it's just probably because I'm anxious. Well, you know what? If you fit all the parameters, I'm still going to tell you, let's go to the ER so that we can get stat laboratories and EKGs. So stay tuned and learn more.
Welcome, everybody, to another edition of Everyday Health Hacker. I'm Michael Herzing, along with the amazing and always awesome Dr. Lisa Leal.
Welcome back. Glad to see everybody and hear everybody. Look forward to your comments today.
It's good to be anywhere, isn't it?
That's right. That's right.
You have to appreciate every day.
Yes, and we've got a great topic today.
We really do. It's just great. Dr. Leal is Chief Medical Officer right here at Meridian Health Institute in Sugar Land, Texas, and our job is to help you make decisions regarding your health. Smart ones too, because this lady is so smart. It's crazy.
You're sweet. Thank you.
I mean, you really are. And I can tell you what, and the best part is you know how to just give that information to other people. Some doctors they're like engineers. They're just so smart, but they have trouble relating to people.
Yes.
And toning it down and making it so people can understand, and you're good at that.
Oh, thank you.
That's
Thank
the
you.
best part. That's why
Thank you for the kind words.
That's why these things work for people, and it works. And then when we still can't understand you, I can help interpret.
Yes.
So it works.
There we go.
Panic attacks, heart attacks, they seem like the same thing for people.
And
it's tough.
For a lot of people, it feels the same thing, and they're not sure what it is. And, we do get those phone calls where, like, I'm short of breath, I have chest pain, and we're always like, right, left side, where's your pain? And, the best thing to always do is to go to an emergency room. And when I say an emergency room that is hooked to a hospital, because you don't know if it is a heart attack. Some of the things that occur are the shortness of breath, the chest pain. Mm-hmm. And when that occurs, I still always share with people, go ahead and take an aspirin and let's call the ambulance or let's get you over to the ER as fast as possible. At that time, they'll do an EKG. They'll take your lab work and they'll determine, usually on an EKG, we can see if there's a heart attack. And sometimes that EKG can be absolutely normal. And it isn't until the third laboratory test that we get an elevated test, that's why we have two different types of tests, a CPK test and also a D-dimer. And I really like the D-dimers because that's telling us a lot more. A panic attack, all of that's going to be negative. So that's wonderful. But again, sometimes you need a little bit of medication to help bring that level low. If you're having a panic attack and you're not sure what to do, the first thing that I always say is put your head between your legs and just take deep breaths. Maybe you'll breathe in a bag. Maybe you will take your finger, rub on the vagal. We talked about that in one of our other previous podcasts and YouTube videos so that it'll help to bring down your heart rate. A panic attack can also come from not a heart attack, but atrial fibrillation. So all three of those are different scenarios. All three of them are treated very differently. And I encourage is to be required to go to the emergency room.
Sometimes your heart just feels like it's speeding up and speeding up and speeding up, and it's just going to beat out of your chest, and you're kind of basically tripping out here, just going, and that's going to be your AFib. And
yes.
All of a sudden, you'll check your pulse, and it's 150, 175, and you're going, wait a minute, I'm not trying to run a marathon here. I'm just sitting here, and you need to get some help right away.
And a lot of times when people are in AFib, if they have an Apple Watch or they have, one of the different type of smart watches on, they're going to see 50, 150, 200. It's just going to be really erratic because a lot of times the watch can't keep up with what is occurring. Oh, yeah. So if it looks really erratic, okay, that's not typical. That needs immediate. Now, a lot of the smartphones and smart watches can now tell you that you're in AFib. And some people have medication that they can take immediately. That more often than not, we're going to say, I need you to go to the emergency room. Because that is our concerns. Our biggest concern is that you're going to have a heart attack. The second one is that you're going to have a stroke. So that's why the aspirin is really important in both of those scenarios, is to help thin out the blood as much as possible and quickly.
Sure, I know. But also at the same time, it's really hard for your blood pressure not to be crazy at the same time, isn't it?
Yeah, sometimes it can go too low because it's trying to equilibrate. And if the heart is beating so fast, it can't build the pressure in
Okay.
order to do that. And other times it's beating enough in synchrony that it's actually building too
Yeah,
much
your
pressure.
blood pressure is,
So
I've
both
seen it. Yeah.
both sides are not a good
Yeah.
scenario.
200 over one something,
Yeah,
and
and
it's nuts.
those are dangerous. That is a stroke potential.
Yeah, easily. And a stroke is none of anything of any kind of a stroke is none of it's good.
Correct. And I always say, people will say, "Oh, it's just a small stroke," and I'm like, "Oh, it was the transient ischemic attack that recovered in 24 hours. You're very fortunate that that's all that was, but let's not repeat it."
Yeah, versus the kind of stroke where one half of your body is
Paralyzed.
paralyzed. Yeah, and you have to learn how to talk and walk and things like that. You're lucky you're not one of those people. So the bottom line is, let's not mess around with this. We really need to take care of this.
Yeah. And a lot of times people are like, "Well, what type of emergency room do we go to?"
Yeah,
And we
that's
have
the
a
toughest one.
we have a whole play series though on emergency
you sure
rooms
do.
and which ones that you should go to. So, that is going to be your highest level of going to an emergency room. Easiest way to remember is one that's attached to a hospital. They're fully equipped to take care of you because we have what we call stroke scenarios, and we also have heart attack scenarios where immediately there's certain medications that have to be administered, some within hours, some within 24 hours, in order to reverse the consequences. So the faster you can get there, the faster we can take care of you.
I'm not saying the other kinds are better. They're better than nothing. Don't get me wrong. If you're in the middle of
And
nowhere,
there have
yeah,
been many a
absolutely.
times where I've
Yeah.
received a phone call from a patient who is at an urgent care center and they're being transported by either,
Right.
an ambulance, because at that point you are now in their care, and they're able to help support all the way there. And
Right.
they're pretty close, but again,
If
if
can
you
get-
have that opportunity, that's one of the best opportunities to
that
utilize.
that is actually very, very important. So our last few series, osteoporosis, we finished up that one.
Mhm.
We talked about
Cholesterol.
cholesterol and triglycerides and
Mhm.
all those wonderful things.
And-
We've just been just a ray of sunshine this week.
we have the holidays that are coming up, and
Yes.
everybody always has a birthday. And there are times that we celebrate, and people are like, "Well, I don't want to take my cholesterol readings because,
Oh,
it was just
yeah.
after Thanksgiving, or I just had Christmas, or, I had a birthday party." Whatever it is, don't allow the excuse to prevent you from knowing the truth to help make decisions for a better future for you and your family, because your health affects other people. And when you take care of you, you get to take care of others. And we like
Okay,
that scenario.
Quick question
Yes.
on heart stuff.
Mhm.
They always say, "Well, you've got to stop all caffeine. No chocolate, no coffee, no this, no that. No dark chocolate.
Mhm.
How big a deal is that?" Well, okay.
Great
She
question.
snickers, she
Great question.
snickers.
Because, people who know me know I enjoy dark chocolate here and there.
Maybe.
Not all the time, but every now and
Coffee,
then
not
you
so
get
much,
you get a
yeah.
craving. I've never been a coffee drinker, so
tea.
I've been fortunate not to. And I like herbal teas.
Yeah.
So I'm not a big caffeine person myself.
Well,
There
chocolate,
are lots of families, and especially my families that have 3 and 4 children. They've got all different types of schedules, and they have their careers too. And I can understand why they would need a cup of coffee in the morning to get started.
hot chocolate is
And also, what if I can encourage that person to do their workout in the morning to get the blood flow going? It is so much better for the future than it is taking that caffeine.
okay.
So
in other
so
words,
that's where I'm going to encourage everybody, is that if you can get your workout in the morning. And a lot of patients were like, "I can't get to the gym that early." And I'm like, you know what? YouTube has plenty of free videos that can get you 20, 30 minutes of a workout, whether it's stretching, yoga, Pilates, a HIIT, which is a very high intensity cardiovascular intensity. Choose one, but the key is to keep moving. You get the blood flow moving, you increase your oxygen in the morning, and truly that's all you're going to need.
so we really need to kind of stay away from caffeine. Is that
Yeah,
the
that's what I'm
answer?
saying.
Oh, really?
Yes.
Say it's not so.
Again, I prefer the decaf.
Well, so decaf's not so bad.
Decaf is not so bad, but again, I do herbal teas.
Yeah. Okay. So herbal tea is okay.
Yeah, I love jasmine herbal iced tea, hot tea. Great. And I prefer it to be cold because, we're in Texas, so everything's kind of iced here.
It gets
We
freezing
like
cold
iced
down
tea.
here. It gets below 60.
Yes, about once every 75 years.
Yeah, I know. I know. It gets cold. So, all right. Anything else you want to add to it?
So, if you want to check if you're heart healthy, call your primary care physician, schedule a physical. If you haven't had a cardiovascular evaluation with a cardiologist and you are 50 and over, I encourage you to make that phone call as well.
Any kind of insurance coverage on that? There's no any kind of
Abs-
like yearly
Absolutely.
stuff?
You know, there's for cardiovascular, usually your primary care physician will refer you to a cardiologist. But do believe that if you have high cholesterol and you have not had a treadmill test, you haven't had an ultrasound of your carotids, an echo of your heart, that it's truly worthy of doing so that you can be ahead of it and be preventative. Preventative is the key because I never really want you to need the cardiologist.
Like the ultrasound and
Yes,
things like that? all
ultrasound
that
of the
good
heart,
stuff?
echocardiogram.
There we go. All right. So basically, we need to get checked out, and that way we'll have a baseline when we get a little bit older. We'll go,
Yes, and you have
okay,
something to compare to because I believe in anti-aging and I want to reverse aging, which means you have to reduce inflammation in your body. And that is a lifestyle, and that's what we talk about on Mini, and we'll talk about that soon here as we begin the new year.
somebody that looks like they're 35 wants to reverse aging. Come on, give me a break.
Yeah,
Huh.
add 20.
That's just not fair. Just
Add
not
20.
fair. All right. All right. Anybody has any questions or any topics you want us to cover? info@everydayhealthhacker.com. We love to answer it. Actually, I have no problem because she's the one that answers them. So send as many as you want. It's not a problem.
You guys have a blessed day and a blessed week, and we look forward to all your questions and comments.
See you soon.
Like and subscribe.